Welcome to today's podcast. And today we've got Dr. Stephen Thwaites. He's an osteopath and chiropractor, and he's been providing relief from pain, improved quality of life, restoration and freedom of movement, with enhanced physical performance in all aspects of daily activities for over 25 years. Welcome, Stephen.
Welcome, Lewis.
Thank you.
Thank you for having me here.
Not a problem. Now, to get a feel for what you're all about, can I ask you a few questions? And first of all, how have you been in business, and what got you started, and how did you develop your expertise?
I've been in practice now for over 25 years. Originally I had some problems myself when I was younger, and used to be somewhat of an athlete. High jumping, I hurt my neck one day. I was only a teenager at that time. I saw several doctors, none of them could help me. Eventually saw a chiropractor, and within virtually one treatment, it was like a miracle. I was suddenly cured, so I knew this was something that I wanted to find out more about.
So you basically got started because of your own problems, and you thought, well, this is good. The normal medical treatment wasn't working, and that's how you saw it?
Yes, well, I guess that was an early experience, but that was in Adelaide. I went to school in Adelaide, and then later came to Sydney, and just by chance met a couple of practitioners just through some friends who were, again, seemed to be working miracles with their hands, and I thought, this is something I want to find out more about. I was always interested in the human life sciences, I suppose you could call it. Biology and physics were a couple of my favourite subjects at school. So the sort of combination of those principles, I think I brought across to apply in my field of expertise.
Right, and so from that, how you joined the medical school straight away, or was there a delay, or what happened then?
No, I think I actually, in those days, to study osteopathy, it was a private college. It was actually part of the natural therapies field at that time. These days, to become an osteopath or a chiropractor, one has to do a science degree at university. But in those days, it was probably much more of an apprenticeship type of situation, where you started at the beginning with someone who mentored you as well. We did study the life sciences, biochemistry, physiology, anatomy, all the grounding in the medical field, but yes, it came initially out of just an interest to find out more about it. Funnily enough, I never actually thought I didn't see myself in practice at the end of it. I just started on the journey out of curiosity, and one thing led to another. So I like the combination of using science and also being able to use my hands to help the healing experience. So.
Right. Well, it sounds to me like it's obviously more than a job to you. It's a definite passion.
Yes, it definitely came out of a passion, and like with any professional business, we have our ups and downs, but I've managed to maintain the passion over the years, and one of the greatest pleasures, I think, is helping people. People say to me, "Oh, don't you get sick of hearing people complain about their problems and looking at sore backs?" I say, well, you missed the point. The point is the end goal, to see that person comes into your clinic to begin with, they're like a bear with a thorn in their foot. They're all grumpy, and everything's bad in their life because they're in pain, and within a few treatments you turn them around, and won many a good friend over the years through practice, as well as obviously just working with people on a professional level. People always come back years later, and sometimes you think people forget about you. Years later they come back and say, I can't believe the difference you made when I saw you 5 years ago, and I haven't had any trouble since then. So, of course, not everyone's a miracle cure, but we certainly get our fair share of great results.
So it's obviously, to me, it's obvious that you enjoy the results that you provide. It's
Absolutely so, yeah.
right. So how would you describe the type of therapies that you do?
Well, they're manual therapies mostly, treating mostly mechanical problems of the body. Some of them have a neurological component, things like sciatica, referred symptoms, headaches, things affecting the nervous system through the framework of the body. So we work to restore normal movement, restore mobility, and remove restrictions or impingements of the body's ability to heal itself. Ultimately, the body will heal itself if you give it the right environment and the right conditions to do that. So that's what we try to do with our therapy, is restore the body's natural healing processes, and allow the body to recuperate and regenerate through its own natural means.
Very good. And what makes you different and interesting in your area?
I think the fact of the vast amount of experience that I've had combining different therapies too. I've always been somewhat of an eclectic, and I know people sometimes have disparagingly talk about people being jack of all trades and master of none, but I've tried to become master of many over the years, but the road does go on forever in that regard. So always constantly learning, still attend seminars regularly, and yes, each week and each month is a learning experience, as well as being able to draw from my tool bag of many areas of experience and techniques that I've learnt over the years.
So depth of experience is a big thing, I would have thought.
Certainly, yeah. Nothing replaces experience.
No, absolutely. Totally agree. So what sort of people would most benefit from what you do?
Well, we treat people across all walks of life, and definitely the weekend warrior, people who sit at a desk all day, and like most people these days, there's lots of, many people stuck behind a desk, behind a computer. I think that these days that's probably most responsible for many of the conditions that we see, is the fact that people are so sedentary, and then perhaps have bursts of activity and end up injuring themselves. So I like to think I like to treat the average person to make them more effective, not only at work but also to enjoy their leisure life to the maximum as well.
So can you give us some examples of what kinds of people that you've worked with, and what did you actually do for them? I mean, you talked about the weekend warriors.
Yeah.
What do they typically present to you, and what have you been able to do for them?
Certainly the share of sprain, strain, injuries, people overexerting themselves. A lot of problems are posturally related. What I was saying about people being stuck behind desks and computers for hours and hours. The body was really designed to thrive on movement, and unfortunately most of us these days are spending a lot of our times in a static position where the body is not moving as it should. So where there is movement, there is life. So that is our goal, to restore movement and ultimately improve the quality of life.
Well, I like the idea of, what was it, movement? And what? Where there's movement, there's life.
Movement, there's life. Yeah.
All right, I'm going to remember that. That's a good one. Can you talk about a favourite therapy that got a great result for one client in particular?
Yeah, well, there's so many stories in that regard. People who've been destined for the surgeon's knife and given up all hopes. Unfortunately, my profession often tends to be the last stop on the train before the journey to the hospital. And yep, I could, without mentioning obviously to specifics of people's names, but certainly we've helped many people avoid the surgery and all the often devastating effects of that. So,
is there one particular person that sticks out in your mind that, you know, was about to have a particular kind of surgery and you were able to treat the person so that the surgery was no longer required?
Yeah, well, there's, like I said, there's too many to mention.
Sure.
Certainly, people with disc injuries would probably be one of the biggest things that we treat, and the doctors will tell you that there's no hope for that type of condition if you've got a herniated or prolapsed disc. But with some regular care and the appropriate techniques, as I said before, about the fact that I can combine different techniques, deep tissue massage, acupuncture, osteopathy and chiropractic, I will often get results where perhaps results haven't been seen before, even if people have seen other people in similar areas, similar professions as myself. Then without results, sometimes when they come to me, the fact that I can combine and pull out the right tool for the situation, as in the right technique, or the right therapy to use, or combination of therapies, will often get results.
Right, so sometimes it does require a multiple therapy approach to get where they want to be.
Yes, absolutely. So yeah,
okay.
I mean, sometimes simple problems, simple measures are needed, but often for more complex problems, then that's certainly where being able to draw from a number of techniques or areas of expertise can often make the difference.
In the profession for 25 years, and you must have seen a lot of changes. And what do you see happening?
I think the main thing is that we've become probably more accepted by the medical profession, where we perhaps was manipulation and acupuncture techniques were seen as fringe therapies or quackery. Many of the medical doctors have incorporated some of these techniques into their area of practice. Certainly most of them don't have the depth of experience or training that we do. Someone like myself who's specialised in the field of manual therapy. So mainly I would say the integration and the mutual recognition of certainly the benefits of conventional medical therapy combined with so-called alternative therapy. I think there's been recognition from both sides of the field that we all have something to contribute to the, ultimately, of course, the welfare of the patient is the most important thing. So certainly, these days, I know when we go to certain seminars, they have people who are medical specialists talking about how they're getting results with certain surgical procedures. So as well as them actually being there to listen to how we're getting results with the more manual approach to therapy. So certainly the integration of the medical and the alternative is the biggest trend that I see.
Yeah, that's a trend I've noticed over the years myself, and certainly it's become a lot more mainstream, even with the people that I know going to see people such as yourself, whereas in the past that was just not even an option. So I definitely see, and also seeing people that are getting results and they're telling other people. So, I see that as being a growing trend as well. Well, thanks very much, Stephen, for this little interview, and I think that I wish you very good luck in the future in your practice.
Thank you, Lewis. Well, I appreciate you taking the time out of your busy schedule today to come and talk to us here. Thank you very much.
Thanks, mate.